This is the sternum of an adult individual, or two parts of the sternum anyway. So this is the anterior view, so this is the front of the sternum. And superiorly, so this bone here, this is called the manubrium. And then inferior to that is this longer bone, and this is the body of the sternum. And then there's a little piece right at the bottom as well, inferior to the body. And this is usually cartilage, but sometimes it does ossify into bone, and sometimes it fuses onto the body as well. But that little extra bit would be called the xiphoid process, which this individual doesn't have. So features that we can see from here. So if we look back to the manubrium, and if we look right to the most superior point of the manubrium, you can see here, this little notch right in the middle. This is called the jugular notch. And then lateral to that on either side, just here. So can you see those smooth sort of notches on the sides of the top? These are the notches for the clavicles, so the clavicular notches. This is where the clavicles articulate with the manubrium. And then also on either side, but a little bit further down, so these points here. These are the notches for the first ribs. So the first ribs will attach here and here on either side. And then further down, at this point where the manubrium articulates with the body, this is where the second ribs attach. So you get notches for the second ribs. They're not very visible on the manubrium, but you can see just about the little contour change at the top of the sternal body where you have those little notches for the second ribs. And then sort of continuing inferiorly down the body, we have these other little notches, more or less at the same height on either side. So these are the notches for the third, fourth, fifth, just about here, and sixth ribs. And then inferiorly, where the body meets the xiphoid process, we have the notches for the seventh ribs as well. Can't always make them out clearly, and they sort of go a bit awry on this individual. We've got 3, 4, 5, 6, I can definitely see on that side, and then possibly something that would be happening, something right on the base. 3, 4, 5, 6, whoops, on this individual. You don't always have to be able to see them clearly, just be aware that this is what they are, articulation points for the ribs. So, and that's the anterior view. So this is the posterior view. No particularly notable features on the posterior side. On some individuals, there will be a little foramen right in the middle of the body, and I can see a little, maybe it's more of an enlarged nutrient foramen there, but just be aware that sometimes you can get quite a large round walled hole in the centre. This isn't any form of healed trauma, it's just something that develops in some individuals. So this individual might have the beginnings of one, but in other people it looks like it perforates the whole thickness of the bone. But it's not anything to do with trauma, it's just a normal non-metric feature.